Indonesia still faces nutritional problems that severely impact the quality of its human resources. Currently, the country is home to over 6 million stunted children. Many factors contribute to childhood stunting: poor nutrition, poor sanitation, lack of proper health care for children and their mothers, and inadequate psychosocial stimulation. On top of that, 48% of pregnant women in Indonesia are anemic, which means a high-risk factor that affects the baby's growth and can potentially cause women to give birth to a stunted baby. To reduce stunting, the Indonesian government has targeted stunting reduction to 14% by 2024. With more than 17,000 islands and 270 million people across these islands, meeting these targets is a big challenge, especially in this pandemic. The country requires a multitude of measures and stakeholders. Last year, recognized the crucial role of supporting community-run Posyandu in villages in order to spread knowledge on the risk of stunting among families, especially those currently with pregnant women. During the project duration, worked with 40 Posyandu in 14 different villages in West Java and Central Kalimantan. Our aim to prove that a holistic approach focusing on pregnant women could reduce the number of babies born stunted. Posyandu is the primary milestone in monitoring the growth and development of pregnant mothers, babies, and toddlers. Basic health services at the Posyandu cover at least the 5-table system: registration of participants, gathering anthropometric measurements of all participants, data collection input into the health card, health and nutrition education by a midwife, and health services, family planning services, and immunizations. Based on our observations and monitoring of the 24 Posyandu in West Java, all of them are now implementing this 5-table system. In most Posyandu, growth monitoring is still based on weight indicators according to age. However, the Posyandu that have been monitored by the project are now also calculating height measurements according to age in order to be able to define a child as being stunted or not. The role of the Posyandu is crucial in the fight against stunting in Indonesia. Within the Posyandu, the kader monitor each woman's pregnancy and the development of each child through anthropometric measurements so that growth problems can be detected as early as possible and stunting can be prevented. During the running of the program, a total of 211 babies were born in West Java and 128 babies in Central Kalimantan. Data collected in West Java indicated that only 7% were stunted. As for Central Kalimantan, 12% were stunted. In comparison, stunting prevalence in Indonesia is currently at 24%. We believe these results were possible thanks to several complementary actions: providing nutritional supplements to pregnant and breastfeeding mothers from vulnerable families. Eating healthily during pregnancy will help the baby to develop and grow. However, during pregnancy, poor diets lacking in key nutrients can cause various health issues, while for children, it can lead to low birth weight, wasting, developmental delays, and stunting. In order to ensure that the pregnant women in the program were eating sufficiently, frequently, and nutritiously, delivered food packages during the duration of their pregnancy and even for some after their baby was born. Aiming to support 400 participants, ultimately assisted 587 pregnant women, 370 in West Java and 217 in Central Kalimantan. The average age of the women supported is between 20 and 35 years old.
Saya dapat nutrisi dari alhamdulillah dari usia hamil 2 bulan sampai usia bayi 3 bulan. Alhamdulillah saya sehat, anakku juga sehat, lahiran normal, sempurna. Sangat membantu banget.
The food packages consisted of a mix of rice, protein, vegetables, fruits, and milk. In Central Kalimantan, where families have vegetables and fruits growing in their garden, the nutritional supplements would focus on milk with added nutrients for pregnant women. In view of providing food security to vulnerable families and future pregnant women, the project in Kalimantan also supported almost 450 families to create home gardens with a variety of vegetables growing in them. Controlling anemia levels through iron supplement tablets and hemoglobin level checks. Since pregnant women are at high risk of suffering from anemia, which can lead to bleeding during childbirth, provided iron supplement tablets to all pregnant women in the program after consultation with the midwife. The staff helped to monitor, along with the midwives, how many tablets were taken. The recommended period is 60 days in compliance with the Ministry of Health. Beside providing iron supplement tablets, free hemoglobin level checks were performed for all pregnant women in their first and third trimester. In regards to the hemoglobin level of the participants, we found that in West Java, 24% were found to have a high risk of anemia, and even more importantly, 8% had a high hemoglobin levels, which can lead to blood coagulation. In Central Kalimantan, thankfully, 88% of the pregnant women had normal levels.
Semenjak dibantu sama Yum, alhamdulillah kayak yang tadinya nggak tahu masalah gizi, tadinya nggak tahu sama sekali masalah gizi kan karena kita suka training, ada suka training di Yum. Jadi kita pun nyampein ke masyarakat, kita adain penyuluhan. Nah dari situlah masyarakat jadi makin tahu kegunaannya. Posyandu itu apa?
Increasing the confidence and knowledge of volunteer health workers around stunting. In the 300,000 Posyandu that serve more than 30 million mothers across Indonesia, the quality of healthcare services provided through this traditional model greatly varies, as most of the kader lack training and critical skills needed to recognize or properly attend to the issues contributing to high stunting rates. This is why it was crucial for the project to place a high priority and invest in the training of the 125 kader in West Java and 41 in Central Kalimantan. The training does not simply aim to provide them with the knowledge on stunting, pre- and postnatal care and child development, but we also make sure that they are confident with the knowledge they receive. A pre- and post-test was conducted during each training session, resulting in 87% of the kader having either improved their pre-test scores higher than expected or as expected. The kader were very excited to join in the training program because they received valuable information that they can use during the Posyandu activities when they received questions from the mothers. The training was also an opportunity for them to feel more empowered and useful in their role. Increasing local awareness around stunting through communication campaigns in collaboration with volunteer health workers. To increase local awareness around stunting, our main aim was for the kader to deliver the information they had received in the training to all the mothers and pregnant women in their Posyandu. What we learned, especially in West Java, was that most of the kader felt unprepared to deliver a presentation in front of an audience. To help with this, provided them with flip charts created by the 1000 Days Fund. These flip charts greatly assisted the kader during their presentations about stunting. Besides these flip charts, posters and banners were created and installed during each monthly Posyandu gathering. In Central Kalimantan, as all 16 Posyandu were closed during the duration of this project, each kader went door to door to deliver the information on stunting prevention at the same time as they delivered the food and packages to pregnant women. In total, close to 1,100 babies, pregnant and breastfeeding mothers, and volunteer health workers have benefited directly from the support that was given. More importantly, together we were able to demonstrate that a holistic approach combined with the collective effort of and the volunteer health workers can achieve wonders. But our efforts don't stop here. Hundreds of other Posyandus around our working areas are in need of support. Will you join us in our efforts? Join us in our fight against stunting.